Okay, we are also standing by live right now outside the International Center in Mississauga, and that is where an overnight vaccination marathon kicks off tomorrow. It is called Doses After Dark, aiming to get 7,600 shots into arms over 32 hours nonstop. This clinic, also opening at Bramley Civic Center tomorrow, dedicated to members of the Black, African, and Caribbean communities. And it's all residents aged 18 and older who are able to book that vaccine. So it's a very big weekend ahead. We are joined again by Dr. Lawrence Lowe, Peel's top doctor. Good morning to you, Dr. Lowe.
Thanks for having me, Mel.
All right, this is great. The Doses After Dark. Where did this idea come from, and why is it so important to do?
So really, I think the aim is to try to target two different demographics. And first of all, we're trying to make it fun and hip for our 18 to 40 population, trying to make it a little bit enjoyable. There's going to be I'm going to show up. We're going to try to get Dr. Isaac Bogoch, some other famous physicians out there to come by and cheerlead and also hand out vaccinations and try to make it fun for the younger demographic that just opened in our community. But we also have, for example, a lot of shift workers in Peel, and we have heard that there is demand for overnight and late evening, early morning availability. So this is also really a pilot to see if we're able to fill appointment slots during those times as well.
Do you know what it looks like when it comes to people booking? Are you almost at capacity, or is there still availability?
There's still availability. So I think the message I would say to everyone is certainly if there is success, especially with the overnight hours, which is where we're not necessarily seeing as much uptake as during the daytime hours. But if we see success and we think that this is an event that is successful, we may integrate more late evening and overnight availability into our clinics. And plus, there's going to be a lot of fun. You should come out, get your first shot at the International Center. There will be secret giveaways. They're so secret, my team hasn't even let me know what they are yet. And of course, the best giveaway is going to be getting your first dose of vaccine and being part of the collective effort to get back to normal.
It's really smart. And to clarify too, it's for those who live and work in Peel that are 18 plus, correct?
That's correct. We're fully recognizing, the focus is as much as possible on Peel residents, especially in Malton, which is that neighborhood around the International Center that's been particularly hard hit. But we also know that the many people who come and work in Peel, you're also part of the community when you are here and you may be connected. So we urge you to also get your vaccination at the International Center overnight if you can this weekend.
And a very important targeted approach when it comes to your vaccination clinics this weekend, a clinic open for Black, African, and Caribbean residents. Can you tell us more?
Absolutely. I think, as part of our overall strategy, we've been using our mobile and pop-up clinics as much as possible to really target the hardest to reach in our community, those that might face really significant barriers to getting to a mass vaccination clinic. We know for our Black, African, and Caribbean population, historically there may be distrust and justified distrust in medical institutions and a need to really ensure that there's a culturally congruent context when they're receiving medical services. So we've been grateful for our partnership with Roots Community Care and the Black Physicians Association Ontario to offer this clinic up at Bramley.
I wanted to get an update from you, Dr. Lowe. I think it was maybe just as of a couple weeks ago, the percent positivity in Brampton was at 22%. We've seen it slowly dropping. Where does it stand now?
So right now in Brampton, it's at 16%, and across the region of Peel, we're sitting at about 12-ish percent, which is all very favorable, I should say. We're seeing the trend go in the right direction. However, our hospitalizations haven't resolved yet, and that is really our escape valve, because cases, some of them become hospitalizations and ICU stays, and those haven't stabilized or cleared out at this point in time. So we certainly think of all the patients in our community that are still in the hospital or being transferred all across Ontario to get treated. We need to see all the trends improving and our vaccine coverage getting up to par so that we can get out of this altogether.
Yes, indeed. Very quickly, I know we're getting wrapped up here, but the stay-at-home order being extended to June 2nd, yay or nay from you?
I think it's going to help. It's going to keep contact interactions down, and that's what we need to do while everyone goes out there and gets their shot. So come to Doses After Dark, come out to Bramley if you're a member of the Black, African, Caribbean community, and let's get to 75% first doses in Peel.
Dr. Lowe, appreciate your time all morning long. Thank you so much.
Thanks for having me.